The 87th session of the Texas Legislature began on Tuesday. The crucial lawmaking time only rolls around once every 2 years. But this one will be very different than what we've seen in the past, from a leaner state budget to virtual learning policies to coronavirus restrictions. Texas lawmakers are facing a brand new set of issues this year. Earlier this week, I sat down with Democratic State Representative Julie Johnson of Farmers Branch to hear more on what she can expect this session. Democratic State Representative Julie Johnson from Farmers Branch, thank you so much for joining us today. Really appreciate your time. So the session starts on Tuesday, and obviously this is going to look very different than in past sessions because of the pandemic. And so I'm wondering how you're going to be impacted and what your policy is for your office this time.
Well, obviously there's a fine balance in managing public access, which is very important, that the public have access to their legislators, combined with safety. So we're all going to have to be managing that. And it's probably going to evolve as the inoculation rate goes and the vaccination rate improves. So at the outset, obviously the Capitol is requiring testing for people who are entering the building and masks, and we will be utilizing those same requirements and protocols. And just to make sure that my staff is safe and I'm safe and that the people that we're interacting with are safe. But we're committed to, meeting with our constituents and other interested people as conveniently as possible via Zoom or, online or certainly in person. I'm certainly willing to do that as long as certain protocols are in place. And
are you satisfied with the protocols that the House has put in place? And I know that final rules are going to be determined after the selection of a speaker.
Yes, I think everyone is really concerned and committed to making sure that everyone is as safe as possible while maintaining our constitutional obligations to do the work of the people and to be open and constitutionally accessible. So there's a balance there, and I believe that Chairman Charlie Guerin of the House Administration Committee has certainly done a great job of navigating that and putting some procedures in place that balances all of those issues.
And given what we saw at the U.S. Capitol on Wednesday, are you aware of any discussions taking place to, make sure that something like that doesn't happen at the Texas Capitol, improving security, and what are your concerns?
Well, the right to protest is fundamental in our society, in our country, and in our state. And people should have that right to protest when they feel that they have a disagreement with their government. However, it must be done safely. It cannot be done in a riotous, unsafe, violent, destructive, vandalistic way. It's my understanding that there's some protests planned for the opening day of the session, and that the Capitol, the National Guard's been activated, and DPS has been on alert, and there's definitely going to be enhanced security at the Capitol when we're all sworn in on Tuesday. Because we are expecting protests that day, from what I understand. But we'll see. I intend to be there. I will be there in person, getting sworn in, as I'm constitutionally required to do. Obviously, we'll all be more mindful of what's going on and definitely be on a higher standard of alert to avoid any problems like what happened in Washington this week. But I'm confident that our fine law enforcement and security personnel will keep us safe in the Capitol.
So you're saying that you've already been told that the National Guard will be on the grounds of the Texas Capitol on Tuesday?
That's my understanding.
Okay. And will that also include increased personnel from DPS?
That's my understanding.
Okay.
That increased security is being deployed to the Capitol to ensure that all the incoming legislators and our guests are safe in the building when there are some planned protests outside. So that's my understanding, is that there will be definitely enhanced security in Austin next week.
And do you know who the groups are that have planned to protest?
I don't specifically.
Okay, but they have to, at least there is a requirement to get approval from the Capitol grounds to hold the protest.
I believe so. I believe that's correct, yeah.
So what are your legislative priorities this year?
Well, I think healthcare is first and foremost on the minds of Texans. We've experienced and we are currently experiencing a significant healthcare crisis in our state. And it has really highlighted the lack of emphasis that the Texas legislature has placed on improving access to care. I think the citizens of Texas are demanding that we address healthcare access in our state going forward. We all realize and have learned the consequences of having a poor healthcare system and how it can affect public health. You can have the best insurance and the best access to care possible, but if the person next to you does not have access to care and is transmitting communicable diseases, you can get those. So, we understand how important public health is now and how impactful it can be on each of us in our economy in the state. So to that end, number one, first and foremost, we must pass a Medicaid expansion bill. And we have to figure out a way to provide coverage to the 5 million Texans that do not have access to medical care. It is inexcusable, the status of that in this state right now.
Has there been a change of mind by Republicans, the governor, the lieutenant governor, that you're aware of? Because even if there is Republican support as far as from House members or in the Senate, it's not going to go anywhere if the governor or even the lieutenant governor are going to sign off on it, right?
Well, that's true. And I think it's incumbent upon the governor and the lieutenant governor to hear the desires and the wishes of the people. And it's incumbent upon the people to make those desires known to the governor and the lieutenant governor. Many of my Republican colleagues recognize the need for Medicaid expansion. Many of our rural Republican members, their people are hurting, they're suffering. Hospitals are closing. They have to go travel hundreds of miles to get access to a hospital in the event of, say, a cardiac case. And in that situation, most of the time they do not survive. So this is a critical issue for Republicans. It's a critical issue for Democrats. Healthcare should not be a partisan issue. Every Republican, every Democrat, every human being needs access to care. So this should not be partisan. I think there seems also to be more of an appetite to finally address this issue because we see the consequences of lack of access to care, but also our budget shortfall. Healthcare is one of the largest budget items in the Texas state budget. And to be able to have basically a 90% to 10% dollar reimbursement from the federal government will add billions of dollars to the budget shortfall in the state budget. So it's an economic issue as well as a health issue this upcoming session.
You mentioned the budget, and obviously that is priority number one in every session. And I'm wondering how concerned you are that there will have to be budget cuts because the sales tax revenues and other revenues are down. It may not be as bad as first thought, but we'll find out the final results on Monday about that. But what are your concerns about that?
Well, obviously, we're facing a budget deficit. We've had a significant decline in revenues. Oil revenues are down, sales tax revenues are down, there's revenues down all across the board. And it's time for us to tighten our belt, really look at the 84 pages of tax exemptions that are out there afforded to people, and take a look at how realistic those are in the current day. But more importantly, things like Medicaid expansion. If we do this one bill, that will significantly reduce or almost eliminate any budget shortfall we have, from what I understand. And many groups have studied this issue. There's multiple calls from various economists and think tank groups that this is sound public policy in Texas and needs to happen. So, I think that there's multiple forces now that are moving this issue forward that Texas just needs to finally participate in a program. The thing that's crazy about it is you and I are paying for this in our federal tax dollars. We're already paying the money. Texans are funding this already, and we're just not getting the benefit of it. And it's just ridiculous to me that we have not stepped up and exercised our right to participate in this federal program to get federal dollars back into our state healthcare system to improve care for everyone.
The concerns, I believe, you tell me if that's not right, have been the 10%. Those costs That's not an insignificant amount of money. So what do you say to those folks, like the governor and the others who say, look, that's still an expense for the state that the state's going to have to come up with?
Well, if you look at what's happening, so right now we have 5 million people that are using our ERs, emergency rooms at hospitals, as primary care facilities. And the cost for that service is exponential what it would cost if they had coverage. So, it's the baskets change a little bit. What we would spend on them to actually have access to a primary care physician and have a routine office visit, maybe that's $150. But right now we're spending $5,000 for them to go have that same care in an emergency room. So it makes absolutely no sense. The state medical expenses, what we're paying for the medical costs of these uninsured folks is outrageous. And they're also not getting continuity of care. That's also coupled with the fact that if people are getting routine preventative care, then they're managing their health and they're not demonstrating these acute medical crises that also cost an excessive amount of money. That also, then, when we have that extra money, those extra billions of dollars flowing into our healthcare system, it only also increases revenue, state revenue, and by virtue of just the business engine those health dollars will fuel. So I think Ray Perryman's done a study that it's a net benefit to the state of several $billion, and it's something that the state legislature must do.
A couple other questions I have for you, and that is, we saw the last session, the state lawmakers, the governor signed legislation to really boost the state funding in public education. How concerned are you that the state won't be able to keep that commitment this time, or do you think that there will be money for that?
Well, I'm very concerned about that. Obviously public education is the #1 driver in our state. Our voters demanded that we address this critical problem last session, in which we did, and I was very proud to be part of that. And I think everyone I know, Republican and Democrat alike, we're all committed to make sure that those education funding levels stay in place. But it means that we're going to have to make some changes in our system. We're going to have to do Medicaid expansion. But I want to address another issue, a priority of mine, which is telemedicine. I have filed a bill to make sure that all Texans have access to telemedicine in our state. I think that one of the things that has come out of the epidemic with the governor's expanded orders providing for telemedicine and requiring health insurance companies to pay for it has been this great access to care. So many patients have really enjoyed the availability of telemedicine, and the business community. Right now, what happens is if you're an employer, you have an employee that needs to go to the doctor, they take off at least a half day of work. When you have telemedicine available, they can just say, excuse me, I just need 15 minutes to get on the phone with my doctor. And they can remain in the workplace. And this is a really important bill to teachers who have a real hard time getting to their physicians. So patient advocacy groups, physicians alike, are really demanding that we permanently put in place telemedicine. The health insurance companies are vigorously fighting because they don't want to pay for it, but we have to make sure that that happens. I think permanently instituting telemedicine in our healthcare system is one of my personal priorities for the upcoming session.
And I did want to ask you about the presumed new speaker, Dade Phelan of Beaumont. Are you going to support him?
Absolutely. I believe Dade he's a great guy. I think he's going to be a great speaker. He has a level hand. I think he will really balance the interests on the competing edges and really keep the House in a centrist direction, which is what I believe needs to happen in order for us to have a productive session. I'm looking forward to his leadership. It's going to be interesting to see how it goes, but he has my full support.
Well, Democratic State Representative Julie Johnson, thank you so much for your time today. We really do appreciate it.